Hey, this is Blaze. We're here at the Biltmore Hotel in downtown LA for a very important discussion this morning. And before we begin doing a pre-interview, we have Dr. Diane Woods, who's going to introduce us to this beautiful young woman who's here for an extremely important purpose.
This is Sharon Yates. Sharon is with the NAMI, which is National Alliance on Mental Illness, the Urban LA chapter.
Yes.
And also interesting, Sharon just finished serving with the President's Special Committee to develop a major report on mental illness, severe mental illness.
Yes, this is in partnership with the Obama's health care plan, the effective health care plan. And I sat in with a group of people from the U.S. Department of Health and Human Services and the Agency for Health Care Quality and Research.
I don't think enough people are aware of this, that they're revamping the mental health department,
Yes.
or what is that in general?
They're revamping the whole system for mental health from the federal level on down to the local county level.
With the intent being, or the objectives being?
Well, one objective is so that our mental health system in the state of California can be more responsive to ethnic and cultural groups. And I say that because the Department of Mental Health, before the realignment took place, was actually proactive in funding 5 groups: the Native Americans, the Asian Pacific Islanders, the lesbian, gay, bisexual, transgender, Latinos, and the African American population, to go out and talk to their particular group of people to find out from their perspective what would constitute good mental health. So I can say that the state of California will have a compendium of recommendations from each population report that will inform them from the perspective of the people as to what's important to them. And then the issue would be funding those things and putting those particular systems in place, and not necessarily talking so much about we're not having the money. We find the money. We find the money to be responsive to what people say would help them to have good mental health.
Why don't you share with our viewers, why do you seem to know so much about this?
I have, for the last 2 years, been working on the project. I'm the project director for the California Reducing Disparities project, the African American Strategic Planning Work Group. And I've actually convened a work group of 52 members that include statewide representation as well as advisors and consultants. And I use an eclectic approach because I believe that wisdom does not reside just in one individual or one group of individuals. So we have a transdisciplinary approach. We have psychiatrists, psychologists, and social workers, marriage and family therapists, anthropologists, but the most important piece is that we have client, family members, and consumers that are equally at the table identifying what is important to them and what needs to be put in place. So we should have a well-rounded population report with recommendations that will go to the governor related to how money should be aligned and what programs and interventions would be more meaningful to people.
Well, if any people that might view this might want to say, well, hey, I have some interesting ideas, are you open for that?
Absolutely.
Well, how would they contact you?
In fact, Blaze, one could go to the African American Health Institute website, www.aahi-sbc.org, and we have posted our draft report that has preliminary findings. It's up for a 30-day public review. The 30 days will end October 31st. We are encouraging people, whatever is missing, to actually send us information that they feel would be pertinent and applicable to inform the strategic plan. The ultimate goal is that all 5 population reports will come together and create a statewide strategic plan addressing mental health issues from a cultural and ethnic perspective. Now, there is not another one of this type of planning process or involvement of ethnic minorities anywhere in the United States. So there's tremendous support from SAMHSA, that's the federal government that deals with mental health issues and substance abuse, etc., etc. And we also have international interest. Many people are not aware that the United Nations declared the year 2011 the International Year for People of African Descent. So for the African American Population Report, we're dedicating our report to the declaration that the United Nations has made for this entire year to work with decreasing discrimination, racism, xenophobia, or any other biases against people of African ancestry. So this is a very important year. Our report should be finished by the end of the year.
I appreciate that, and I'll tag all that. Now, how does it relate to this? As I understand it, this event we're here today with police officers and Downtown Neighborhood Council, a number of interested shareholders, or has something to do with parole, release, or something. How does that impact mental health?
Yes.
If it does?
It does, most definitely. Within the criminal justice system, and many people are not aware either, that the Criminal Justice Judicial Council of California, from the Judicial Council, and it was the Task Force for Criminal Justice Collaboration on Mental Health Issues, and it is their final report. This report was released in April of this year. The final report has been released in June. In this report, there are about 138 or clearly close to 140 recommendations, and this is specifically related to mental illness. So we find within the criminal justice system that there are many people who are detained and incarcerated that have mental issues, and that in fact may have been wrongfully detained because they may not have been assessed appropriately, but nevertheless they are in the criminal justice system. So for this release and the realignment plan, what we have been told is that there are probably 23,000 individuals in this first wave of release that will be individuals that have mental health issues. In fact, they will be individuals who are diagnosed with mental health illnesses and are on medication. That's what I understand.
Okay. Well, you know what? We're doing the whole event before we began. I just wanted to do a moment. One more time, your name, please?
Sharon Yates.
Okay, Sharon, is it okay if I film you?
Well, yes, it is.
All right, great. And let me ask you, you said you had something to do with President Obama's special something or another?
Oh, yes. I'm supporting President Obama and the...
Me too.
Absolutely.
I love President Obama.
Oh, yeah. Yes, we
I love his wife. I love his kids. Did you see his dog? I love him. Yeah.
I'm working on the national health care program that he has to upgrade and improve our health care system. So the piece that I'm working on, of course, is with mental health and creating patient-centered treatment options and not the standard options that have been promoted for the past 50 years. We're trying to improve and reinvent the wheel and improve the process and make these patient-centered treatments, so that the patients will be more likely to embrace recovery.
I absolutely will. I want to thank you on behalf of Downtown Neighborhood Council, who, by the way, purchased this camera for me. See that serial number?
Your finger's covering it up, but
see that
okay.
serial number?
All right.
That means Downtown Neighborhood Council bought this for me, and I'm really thankful that you came to this event today, and this is going to add to what we have. I wonder, Blaze, do you have anything else you'd like to say?
You know, Blaze, I'm glad that you brought that up about the Downtown Los Angeles Neighborhood Council. One thing in our report is that we are promoting and encouraging and putting forth those positive interventions that residents and community people are involved in. And the fact that in our report we are actually profiling 5 case studies of different community-based organizations and local residents that are actively involved in helping to make sure that their communities are safe and that people are healthy and that they are balanced and that they have those particular programs and interventions as meaningful to them. And so the Downtown LA Neighborhood Council has supported many of your resident activities in Skid Row, and the positive movement that you and General Jeff and OG Man and Big Mac and others, Coach Ron and others that have been involved in, people need to know that you're positively doing things to improve your situation. You're not looking for people to give you a handout. You're actually looking for people to truly value and give you the opportunity and assistance to create an environment that's really meaningful to you and helpful and balanced.
All right, thank you so very much. The check will be in the mail. All right, thank you.